hormone deficiency. What is growth hormone deficiency? Growth hormone deficiency is a rare condition which develops in children and some adults where the anterior pituitary gland does not produce enough of the growth hormone. This gland is a small gland of about the size of a pea. It is located at the base of the skull and secretes 8 hormones. Some of these hormones control the thyroid function or activities and body temperature. This symptom is actually severe growth or genetic disease. Adults can also develop the growth hormone deficiency. However, it is not as pronounced as it is in children. What causes growth hormone deficiency? Aside from genes, there are some other causes of growth hormone deficiency. For instance, severe head injury, usually due to some symptoms such as concussions, seizures, hearing loss, or memory loss or amnesia. Tumor in your head or a history of pituitary tumors. This happens due to some abnormal cells that grow in your brain or pituitary glands. Infection in your brain or brain abscess forms when fungi, viruses, or bacteria reach your brain through an open wound in your head or an infection somewhere else in your body. Brain surgery is performed due to some brain diseases such as tumors, blood clots, and aneurysms, epilepsies, or Parkinson's disease. Hormonal problems or simply hormonal imbalances. Other causes also include poor blood supply to the pituitary gland. This usually occurs when your pituitary gland is not active enough. And lastly, radiation treatments to your brain, which generally caused by radiation therapies that treat brain tumors. So what are some of the symptoms that causes growth hormone deficiency? A child or adult who has too little growth hormone will have symptoms that include higher level of waist body fat, anxiety and depression, decreased sexual functions, fatigue, feelings of isolation, great sensitivity to heat or cold, lean body mass, lesser stamina, reduced bone density, or changes in blood cholesterol. First and foremost, children that are at risk of growth hormone deficiency has or has had any of the following. For example, brain surgery, brain tumor, or radiation therapy to the brain. In order to diagnose growth hormone deficiency in your child, your physician will also take into account some other conditions such as normal variations of growth, thyroid hormone deficiency or kidney diseases, and genetic conditions. Once your physician rules out that your child might have growth hormone deficiency through a physical exam, your child may also require other tests such as blood tests, x-rays, CT scans, or MRIs, or also called magnetic resonance imaging. So what are some of the treatments for growth hormone deficiency? The most common treatment for growth hormone deficiency in children and adults is growth hormone therapy, which is through injections of growth hormone into the body. Growth hormones, or also known as somatotropins, can be injected by the patient themselves or a family member. Once prescribed with growth hormone therapy, you will typically require daily doses. However, depending on the activity or the severity of the condition, you may need doses more often. You will continue to visit your endocrinologist every 4 to 8 weeks to continue monitoring your condition condition and see your progress. Your specialist will also ask you to perform more blood tests to help determine whether you will need more doses of the growth hormone. What happens if growth hormone deficiency is left untreated? First and foremost, growth hormone deficiency is treatable. Children who are diagnosed very early in their childhood often recover very well. However, if the disease is left untreated, the condition can result in dwarfism or delayed puberty. Overall, your body still requires growth hormones after you've reached puberty.